all of you for the opportunity to be here. It's a real pleasure, privilege, honor to be with you today to share with you some of this rapidly unfolding and developing area of system science as applied to issues in health, and particularly issues related to health disparities and social determinants of health.
Some kind of an anchor, right? But you can, introduce other ideas.
Yeah, and since all of you have subjected yourself to summarizing your life in one sentence, I thought I'd try to give one sentence about sort of what brings me here. Basically, I have spent between 1 and 2 decades now in devoting my work to developing tools to help inform decision-making in the health arena, and a substantially larger area, something close to 25 years, to build those tools for decision-making in social policy-related areas. And so much of that work has been done in health policy, some of it related to education. But today, we're going to be talking about the particular application of one set of tools that have long formed a central toolbox, the application of system science techniques. Just how many feel that you're quite familiar with what the term system science denotes? A little bit? Not at all?
They're modest.
Okay. That's great. So that, I think, articulates the challenge before us. And Vish, just so I have an idea, in terms of time-wise, when should I be shooting to sort of wind down? 3:20.
We do take a break in the middle.
Okay. So it's a big challenge.
Right?
Yeah. It's a big challenge that confronts us because this is a very deep, a quite broad, and a really rich area that's rapidly unfolding in the health domain. And whether it's issues having to do with classic areas where have been applied, things like communicable diseases. I hear many of you are involved in the HIV work, for example, where models, various levels, models of the immune system, models having to do with sexual transmission networks or IDU transmission networks, they played a really central role in informing policy. 2 other areas, which have more to do with social behavioral aspects, where state-of-the-art modeling is just now being done for the first time. It's an area where there's really a lot of excitement and opportunities. And given the limited time we have available to us, there's no real way I can do full justice to sort of articulating this edifice of system science. But I thought I could do worse than to give you a flavor of it, and to talk with you some about some of its essential features, going away from all the different techniques that are used, agent-based modeling, system dynamics modeling, aspects of discrete event modeling. If we step back, we could take a look at what some of its defining features are. Now, for many years, I used to deliver lectures like this on the basis of, and some people find they resonate with that, but I found in recent years that it's been very helpful, again, with a concrete example, and to recognize and accept the fact that this leads to a buzzing, blooming confusion, as William James said about a baby's first experience. You see a lot of things going on, you're not quite sure what they are, but you're going to be seeing certain illustrated that are exemplars of some of the phenomena that system science is grappling with. And so at the cost of causing a certain amount of confusion, I thought I'd start with an example. And I provided Vish with a bit of information in case there's anyone who's really, really eager to follow along. I provided some links to how you can download the software that I'm using, who could use it to open up a model that I'm going to be presenting. Many of you may want to do this after the class, not during, and that's fine. But I had put onto this site for the course, I created a site specifically for the course where I put resources, and these included models, but also things such as background readings, etc. And one of the areas I placed things was in this area of example models. There's also some copies of the lecture slides and some background material. So if you go into example models in final, there's going to be a model there called Smoking Disparities version 8. And if anyone wants to download it, by right-clicking on this and doing download, you could do so now. I'm going to be opening that model within the software, and you could either follow along here, or you might want to do it later. So calling this software up, what you're going to see is something like this, an opening screen where you'll see this big red sort of indicator, which gives you sort of a bit of an introduction to the software. I'm going to minimize that, make it smaller, and then I'm going to go over and do File, Open, and I'm going to open up this particular example that I'm going to be presenting. And again, some of you may want to do this later. I'm recording this so you could follow along if you were later inclined to do so. Yeah.
You want to do
yeah.
now, so we download the...
You download this so-called model. So you go to that site, the final, and you'll right-click on it, and there should be an option to download down here. Yeah. And once it's downloaded, then what you'll need to do is you'll need to know to where it's been downloaded, so maybe to your downloads folder. And then what you'd need to do is call up that software, okay? And once you call up that software, you should see a screen like this one here. And you'll need to minimize that screen. And that will show you, it won't look exactly like this, but it'll be something with an interface similar to this one. And then you do File, Open, and you would open that particular model, Smoking Disparities version 8. Yeah. Okay. So this model will be a system science model, something called an agent-based model, that we'll be using for the first little bit of this exercise to illustrate some of the features of these sort of models, to illustrate some of the phenomena that they try to capture, and to illustrate some of the types of questions we can investigate with them. Okay? So, recognizing that not everyone wants to follow along in detail, I'll try to remember to sort of take things step by step here. But opening this up will basically load this model in so that we can interact with it. Okay? And here it is. And you'll notice that there's a number of pieces in it. What I'm going to do is I'm going to go double-click on person here, and I will sort of move around, and you'll notice that there's some features shown for person that are going to be central to some aspects of our investigation. So we have a person's evolution in their state at a given point in time described according to this construct, depiction, that at a given time they're either in a, with respect to their smoking behavior, they're either a never smoker, a current smoker, or former smoker, and people move between these states. So, for example, going from a never smoker state to current smoker, they undergo a process of initiation. That's what brings them from this state of being never to being classified current smoker. Being a current smoker, they can undergo this process of quitting or cessation, and they become a former smoker. So at any one time, persons can be in one of these three states. We can further classify their aspects of their situation with respect to other attributes. For example, with respect to pregnancies, they're either in a non-pregnant state or a pregnant state. We also are going to have additional information maintained for this person, such as the identity of their mother, which might play a role in social conditioning and exposure, any children that they themselves have, and a set of other information. So what we're depicting here is sort of a stylized representation of what it means to be a person with respect to this model. Models are all simplifications. They depict a situation in the world, sort of one hypothesis for how things might work in the world. And they allow us to understand the implications of that hypothesis for behavior over time. And I'm going to show you that piece of it. But here we have this stylized depiction of what it means to be a person for this particular model. Person is associated with attributes, such as information about their mother, information about their position in terms of socioeconomic status, their sex, when they were born in the model, whether they were exposed to nicotine in utero. And then they evolve over time with respect to their states related to smoking, states related to pregnancy. Let's try, though, running this model, because a model depicts sort of this, operationally it depicts this dynamic hypothesis for one way we might imagine how things work out in the world. But we as people are not very good about thinking through the nitty-gritty implications of our hypotheses about how things work in the world. We may, on one part of, well, cessation works kind of like this, and relapse like that, and initiation in this way, and there's some interaction between a maternal smoking and a child's likelihood of smoking. But adding all those things up, which is the province of system science, the science of the whole, as it were, adding all those things up and understanding their implication is very hard for us to do in our head. And therefore, we turn to these models and we run them. And that totals things up in a much more consistent way than we can in our head. It's a way of allowing us to understand the implications of this hypothesis in a clear, unambiguous way. So to do this, we're going to go to this model here, and we're going to right-click on baseline here, click Run. By right-clicking on this is going to be an experiment. It's going to be a scenario we're going to run with this model. I provided you with a certain broad set of scenarios that you can play with. Scenarios that run this model, different particular assumptions about people's likelihood of quitting or relapsing, etc. We're going to go and we're going to run it here, and we'll see the implications of the assumptions in the model for behavior over time of a whole population, just of one person, but a set of interacting persons. So we see here, when we ran, we call up this screen here, and I'll simply say run here. And what we'll see is a set of individuals here, shown in green, in a network. But I'm going to show you, we'll pause this for just a moment. You'll notice running things are changing. And I'm going to pause it by clicking on the button over here. What we're seeing here is a population. Each of these people is described by what we just saw at that level of a person. We can drill down from this level of the whole population, and we can see here, for example, one person who currently is non-pregnant and is a never smoker. Another individual here, and incidentally, they're a very high, this goes between 0 and 1, this SS index. It's kind of their quantile position on the spectrum of SES status, so they're very high status individual who happens to be male, and right now is just over 12 years old. Here's person 1. This person is a quite low SES individual, 0.1 versus 0.9. They're female. They too right now are in a non-pregnant never. We're actually starting everyone, for the purposes of understanding, we're starting everyone for this scenario in a never smoking state. Yeah.
How do we get to that?
Okay, so were you able to get it to run? Okay, so if you want to see this, you can go click here and go click down, and then you can change this index to be different people. So by clicking up here, you can go from one person to the next to the next. And one thing I further did was I right-clicked here to drag around the aspects of each person. By right-clicking, I can drag the screen.
Yeah, and
yeah.
How I go from the map, from the
yep.
whole population
yep.
to this.
Okay, so you would click here and you'd go click on population here. Yeah, question. Yeah. Okay, I'll show you. It's a great question. So this population was created out of a set of these people, and we'll set for this model. If we go and we look at how the model is the population of people here, this is a population of a certain size, In other words, there's a size to this population that's specified, and if we go and we look at this, the population size is given as a sort of a symbolic constant. And each scenario here will impose a population size. It will say they're going to be 1,600 from this population.
So you're creating.
We're creating that population out of different people, and each of them is lent different particular characteristics, different sexes, different ages, different socioeconomic positions, as dictated by this element population. And this actually specifies information to assume about what sex they are, for example, with a certain 50% probability they're female, otherwise they're male. We're starting everyone in a never smoking category, for example. We're setting 15% of them to have been exposed to nicotine in utero. Okay? So we're creating this population, and this population is depicted here at a high level. I'd like to highlight a couple features of the situation. Right-click on this, we can drag, and I'm going to tell it to display incomes. This is going to display an income gradient, left to right, where we're treating these individuals over here on the left-hand side being low SES individuals, and over here on the right-hand side being high SES individuals. This dollar sign indicating the relative wealth associated with a given person. So we have low SES people, predominantly clustered with low SES individuals, high SES individuals clustered with. So there's a gradient, and there's income segregation in the sense that we're having this separation of people according to income. Now, this population of people, these individuals, is characterized by those so-called state charts that took place, that characterized whether they were smokers or not, whether they're pregnant or not, but they're linked in a network to other individuals. They're linked in this network to people around them. And if we play this model out over time, we will see the evolution of this population. Some people will turn red, indicating that they've become smokers for some period of time, but they undergo quitting behavior between a gray status indicating former smoker and a red status indicating a current smoker. It turns out that within the social network that are depicted, there's a spread of influence. So I'm more likely to become a smoker if some of the people around me are currently smokers, for example. And as a result of this, what you tend to find is that there's a sort of behavior between smokers. In other words, as you run the model out over time and more individuals become smokers, they'll tend to form clusters, because me being a smoker is a risk factor for you becoming a smoker. Me being a current smoker makes it less likely you'll quit, for example. And the model captures elements of this in terms of its assumptions of how quitting behavior occurs, in terms of how initiation occurs. So you find that there are these clusters emerging. Now, those clusters were not pre-programmed. I didn't impose an assumption there's going to be clusters of people. It comes out of, in what we call fashion, out of these assumptions about how a given individual behaves over time. And I'm just going to go back here while this model runs, and I'll again go to this person here and take a look at some aspects of this. So, for example, this initiation. One of the things we'll find is that initiation depends on their likelihood of initiating on a per year basis. The hazard they're exposed to for initiating in a biophysical sense is affected by a number of factors. Their age, for sure. We know that age is a very important factor in shaping initiation behavior for smoking. But also, it's affected by the number of their connections that are also smokers, their SES index, and whether they were exposed to nicotine themselves in utero. So this model, this kind of simplified depiction of the world, has allowed us to articulate some rules. Posit, if worlds were working this way, what would the implications be? People were affected by their neighbors in terms of their initiation behavior in the fashion depicted here. It depended some on the number of people around them that were smoking, some on their exposure to nicotine when they were still in the womb, some on their SES index. What would the implication be? And running the model over here in this buzzing, blooming confusion, we see some of the implications of these assumptions. We see clusters of smoking. Notably, notably more prominent in this low SES area than over here in the high SES, where smoking individuals do occur, but where they're less in terms of the prevalence. And we can go to the top of the screen, and we can see a number of statistics on this, on the synthetic population over time as this is running. We could speed this up by clicking here, but I'm going to leave it for right now. One thing we could look at is overall smoking prevalence, for example, shown in brown here, and then smoking prevalence among higher SES individuals shown at this lowest one here, and then with low SES individuals. And we'll see that there's a disparity. There's higher rates of smoking, higher prevalences of smoking amongst individuals who are in low SES categories, that's blue, compared to the high SES, that's the green, with an overall average crude prevalence shown in brown here. We see that it's changing time. We started the model with no smokers on it already, so it stands to reason that it's rising. But it's rising in fits and starts, reflecting the fact that there is some stochastics, some uncertainty over time. But we also see some other factors related to this model. For example, we can depict here the number of times that relapse behavior has occurred after a certain point of time since someone's last quitting attempt. So how quickly do they fall back into smoking, where this is here in years. We can depict here the age distribution of smokers and non-smokers, and we see there's a certain age, around 10, below which smokers aren't found, but above which the number of smokers, and the number of smokers changes age in some ways. It's fluctuating statistically a little bit with our smaller population size. We can also depict things such as a relationship between income and years smoked on the part of an individual and plot out these individuals over time. So what we have here, ladies and gentlemen, is a synthetic population where we can collect the sorts of statistics that we might normally collect in epidemiological studies, but know within the model the precise state of a given person. And we can sometimes have a sort of God's eye view of what's going on at the level of that person in a way that wouldn't be economically feasible, wouldn't be practical, wouldn't be ethical in some cases for a real-world population. So we're running this model out over time, and I'm just going to let it run till it's completed, and here it's completed. And I'd like you to note something here that I'm going to come back to show you some additional features. What I have plotted out here on the lower right is the number of cumulative person years smoked by the population. By low SES individuals shown up here in brown, by individuals who are high SES, shown here in the sort of purple color down towards the bottom, and then for the total population shown in green here, going up here to the point of about 3,500. So I want you to take note of that, okay? We're going to run some interventions now. We're going to run some what-if scenarios. If we could modify this, if we could modify that, how might it change things? But this is what we call a baseline run. With default assumptions of the model, what do we see over the span of 100 years in terms of cumulative years smoked in a population of such and such a size? And here we see a total burden of person years smoked, somewhere around 3,800. For those who are interested in going through a bit more quantitatively, you could right-click on this, do copy all, and paste this into something like Excel. So going over to Excel, you could paste in, and you would actually see the data from the model indicating that about 3,778 years, person years have been smoked across this population by year on. Yes?
Just a quick question.
Yes. Yeah.
The coefficient that you have for the economic status.
Yes.
Based on research, or is that?
This is a teaching model. We have lots of other models that are based on studies that have been conducted, sometimes meta-analyses. Sometimes they're based on data from clinical trials. Sometimes they're based on data which is drawn from secondary studies in the literature. But those parameter values are often quite central to understanding the details of how the model evolves, often aspects of model structure, sort of how we characterize things as working in the model, and working in the world in terms of the stages people go through. That's often based on theory beyond the data collection, which is, not quite as empirically grounded by data, but which is based instead on sort of going theories about how things work in terms of openness to change with respect to addictions or with respect to natural history of infection of a given condition. And it's an important thing. If we consider a new emerging infectious disease, for example, there may not be that clarity of understanding of the natural history of infection for that disease. It may be that people aren't sure whether there's an asymptomatic infectious period, for example. And with a model, we can probe what's the implication if there is or if there isn't, and compare the degree of consistency of model results to empirical data in a way that would be very hard to do in our head. So the point is that this particular model is decidedly a teaching example, but in general, the models are highly amenable to being grounded by evidence. And there's about 3 different ways you can bring empirical evidence together with these models. And you can, at a certain level, you can think of the goal of this model as one of the big goals of the model as being to make sense of the evidence that's available to you in a synthetic way. It's not merely analytics that we take pieces apart and understand their pieces in isolation. Instead, this is about putting all the pieces together from multiple data sources and asking what's the implication for certain choices that I have to make? What's the implication for the trade-off between this policy or this intervention and other options? Are those helpful? Okay. Yeah.
I misspoke. We actually stop at 420, not 320.
Oh, okay. That's reassuring. Yeah.
Right?
I just have a question about the age distribution.
Yes. Yep.
I didn't see much fluctuation. Would you expect as people age, smokers who age, you see the distribution changes?
Indeed.
But it felt like it stayed pretty much the same. Didn't change.
Okay. Well, I'll tell you what. We'll watch for that. I think you may be. It may not be quite as visible as you think because of quitting behavior and relapse. But I'll show you, and I think you'll see that it actually is progressing. I'll show you in another run here, okay? So what I've just done is to run a baseline. We've seen some features of the situation. I want to highlight the fact there's a number of aspects of what we call in system science emergence here. There's this general pattern of a relationship between income on the x-axis here and cumulative years smoked here in the model, which exhibits a downwards trend associated with it, which in no way was pre-programmed into the model. There's no point in the model where I said make there be a downward slope in terms of this. This instead is a reflection of the interaction of a whole bunch of different factors. Income in this model affects there's a sortivity by income. If I'm a low-income individual, I'm more likely to be in contact with other low-income individuals. But I'm also a little bit more likely to be open to initiation and a little bit less likely to engage in cessation behavior, both directly and indirectly because my neighbor is more likely to be smokers. So this relationship between income on the one hand and cumulative years smoked is a reflective of a variety of processes in the model. It comes out of the interaction of a set of processes. No one process gave rise to this. So we call this an emergent behavior. Similarly, this rise in the cumulative years smoked, the aspects of the age distribution of smokers and non-smokers, these are the results of multiple processes. Quitting, initiation, cessation behaviors all play a role in shaping this graph here. And this disparity you see between high-income individuals on the lower side in terms of prevalence of smoking and low-income individuals was also not pre-programmed in. It emerged from the interaction of a set of processes. Finally, the prevalence among those in utero versus those not exposed in utero being the one on the top and not exposed in utero is also a reflection of the interaction of a variety of factors. So we see this phenomena of emergence, both factors over time, factors associated with clustering of individuals according to smoking status, this general gradient in terms of smoking between low-income individuals and higher-income individuals. These are aspects of emergent behavior of a model based on the interactions of a variety of factors. Yeah. These are great questions. I'm just so grateful to you folks for stepping forward. Yeah.
Can you import raw data from surveys or surveys?
Yes. Yep.
And what if there's missing parts of the data set that the surveys and surveillance? Can you input that from the model?
Yes. Okay. So this gets to this issue of the nexus of models and data. These models are kind of operationalized theories. They sort of take a theory of how things might be in the world, or a caricature of how things might be in the world, and they help us understand the implications. And data can come together with that in several ways. If we have data directly that relate to assumptions in the model, let's suppose fertility rates over age, you'll actually find those in this model. If you were to go poke around in this model and you were to look at this rate going from non-pregnant to pregnant, it has to do with fertility, and you could see there's fertility rate per 1,000 women, and this is OSK, this is Saskatchewan population, my favorite province. And so this data is actually taken empirically, and we plugged it in for fertility. We said we posit a fertility rate similar to our home province. By contrast, there's other data to which we have recourse sometimes, which can't get plugged in directly to the model, but it's data that the model needs to match. It's data that the model that is emergent from the model. Maybe it's prevalence of HIV in some IDU population, or maybe it's the occurrence of gestational diabetes among women of childbearing years. And this data, we expect the model to match it as an output of the model, not as an input. And in that case, we'll go through a process that is sometimes known as calibration, but involves adjusting things in the model that are poorly known to best match that empirical data. And in that process, there's often opportunity to fill in kind of missing data. We'll sort of try different values of that missing data and see how consistent it is, and try to accommodate it in that sense. And then there's a third way in which you can use data on an ongoing basis to keep the model current with the latest evidence as it comes in incrementally, but I won't be going into that. So in short, when data is missing, it's not just something we have to deal with. It's a very common thing in these models. And basically, the model is about trying to make sense of the evidence that is available and help us add those pieces up and compare it with other data to see if it all jives. It's a way of sort of improving our understanding about how the world might be operating, so that if the model exhibits a mismatch to certain data, it's not a failure, it's an opportunity to learn and to improve that model. And that's a lot of the purposes to which these models are used. Models are not crystal balls you look to predict the future. If I do this, if I do that. They're sometimes used in that way, but they're better used as learning tools and learning crutches that help us reason about the evidence that's available in a consistent way and more quickly identify inconsistencies about how we think the world is working. Okay? So I've highlighted features here of this situation. Just again note that we had this value here going up to about 3,800. And for these individuals who are high-income individuals, the ones in this lower side, we have a cumulative number of smoking person-year smoked of about 800 or so, 800 to 900. And when I actually went and pasted it into here, it's about 769. I pasted it into Excel. So I'm going to close this. This is one experiment we ran with the model. We're going to run a different experiment now. In this experiment, ladies and gentlemen, we're going to try altering an assumption. We're going to lower we're going to reduce initiation by 10%. Okay? And we're going to see the impact of successive reductions in initiation likelihood. If we could posit that we're going to reduce initiation across the board by 10%, what would the prevalence of smoking in terms of years smoke, and other factors. I'm going to run this as quick as possible in this mode here. So and again, the smoking rate's rising here. We still see this troubling disparity between high-income individuals and low-income individuals. And we see this age distribution associated here. And you'll notice it is here at about 10, but it's slowly making its way to the right here as individuals, especially were non-smoking, sort of came into the model ago. Now they're to their 60s, and it's kind of marching along there to the right. And in short, what we have is a situation where cumulative smoking years that have been smoked within this model are continuing to rise. And see some net change. Time of the 100 years here, we'll see some difference. What we did see earlier is the situation of assuming a normal positive lower initiation, and we're seeing what the effects are. So by running this out, we're running the whole population. This is a feature of the models. We're running the whole population, imagining their state. Every person across the population evolves. They switch as they switch between different smoking statuses, as pregnant, give birth to a child, which may or may not be exposed in utero to smoking. And we see there's a somewhat lower burden, a slightly lower burden. Now it's about 3,500 compared to 3,700, 3,800. So there's a lower burden, but it's a very modest gain. Let's try upping that to a certain degree. Let's try lowering this initiation rate by something astounding, 50% within this model. What do you think the savings will be here? How do you think that will affect years smoked? Anyone? Would that be 5 times as big as from 10%? If we decrease the initiation rate by 50%, initiation hazard, the chance per year that you'll initiate. The net gain line will be 5 times as large as it was for 10% reduction. Well, it turns out these models exhibit a character called nonlinearity. Sometimes doubling something will double a certain result. Sometimes it quadruple a certain result. It's a feature of these models that things are not necessarily linear. That if you combine 2 interventions, you may get very different results than the sum of what you get for each of those interventions in isolation. So here we're seeing a 5% reduction. But as we're going to see, the change is not simply 5 times the change from lowering it by 10%. The change from lowering it by 10% yielded a net gain of about 200 or so, in which case we'd expect to be low about 1,000, from 3,700 to about 2,700. Instead, we see a much larger gain. We see a gain. Again, we had it originally 3,700, and now it's something like 1,700. A reduction of 2,000 person years smoked, rather than the gain of about 200 with a 10% reduction. So here, going from a 10% to a 50% reduction, multiplied our gains from that intervention, not by a factor of 5, 10%, 50%, by a factor of 10. Yes?
So, you see the reduction, but in terms of probability,
yep.
You also look at the distribution, what's the probability of that reduction happening?
Yes, yes, you could do that. So here we're imagining a scenario where we presuppose, suppose we could achieve this level of reduction. Another type of analysis models are used for is we don't want to pose a certain level of behavior change. Instead, say want to consider that it may be drawn from distribution. Maybe it's based on intervention studies that have been conducted in smoking cessation campaign in teenagers. And so we want to draw on those studies, and we'll posit that the reduction will be normally distributed within this range, and we want to see the implications. So you can use the model in that sort of context with probabilistic sensitivity analysis, it's called, running it again and again and again with different assumptions about what the gain in terms of reduction of smoking initiation, and you could see the implications, say, for person years smoked. for each of those, and there'll be a distribution there. Does that address some of your question?
Yeah. I guess I'm not sure how you define that distribution to start with.
Okay, so among other things, there may be meta-analyses which have been done in this area to look at the outcomes of, take something like BCG vaccination for TB. There's a remarkable number of studies that have looked at effectiveness of BCG vaccination, and so there are these diagrams which will indicate the mean outcome, the mean impact, and error bars around it, and you can turn those into distributional assumptions for parameters in the model.
This is a follow-up question.
Yeah.
This model is for individuals. You're following an individual over time.
We're following individuals over time in a social context, right?
You're making an assumption based on population distribution. So population distribution is not made on for.
This is true. Yeah, I mean, you don't want to fall prey to the ecological fallacy and assume, that there's you can directly go from one to the other. But there are studies longitudinally, and as part of RCTs and so on, that have followed individuals and looked at impact on behavior. So, without wanting to dwell on this too long, I'm trying to show you some features of the model. I'd like you to now take a look at a situation where we combine multiple interventions. So this is this combined initiation, cessation, and relapse. So one of the uses to which these models are put is to examine the impacts not of interventions in isolation, but of interventions together. A large part of our evidence-based, even best practices evidence, is conducted with isolated interventions. And so many of the times, from an implementation standpoint, there's a desire to combine multiple best practices together in a way that the evidence may not be nearly as conclusive. So models provide here a way of simulating several interventions together, a portfolio of interventions, recognizing these interventions may be synergistic or they may work at cross purposes. So, for example, we could here imagine the impacts of changing initiation, cessation, and relapse altogether and play out the implications over time. So in all cases, what we're doing is we're taking this model, we're pausing a certain way the world could be, certain style of the world, and we're asking what-if questions. What if we could things in this way or that way? We're seeing the implications of our assumptions of how the world might be in terms of changes over time. Doing this in a way that links together multiple components that are often considered at the level, say, of an individual, their behavior over time, their interactions with others, etc. So, for example, aspects of their network, aspects of their initiation behavior as it might be affected by exposure and use of nicotine, or as it might be affected by socioeconomic status. So this model, while a toy example, gives you some sense of the ways that models can be used as part of, notice in this case, associated with tobacco here is greatly reduced. Here we have affected all three of these tobacco-related behaviors, reduced initiation, improved cessation, reduced the likelihood. See, the burden of tobacco use has been reduced by nearly an order of magnitude between in the end, I believe. So here we're running scenario model and asking what-if questions in a way that might help us sense of evidence that we do have in terms of behavior of a population over time. For example, in RCT. Yes. So it's a great question. So we have models where SES is dynamic and some where it's static. In this particular case, there's a very simple assumption that it's static. It turns out that to capture the dynamics of SES would involve substantively enlarging the model to consider aspects of education, consider aspects of intergenerational transfer of wealth. And there are other models that I have, and in fact that I've worked in the group with Vish on, where exactly that has been done. So there's been a more broad articulation of theory, as it were, for how people's health state is affected by evolution of their SES, by evolution of their education, and how that's affected by neighborhood, by family linkages, etc. But this particular model, it's static, and a baby inherits the SES of their mother. Okay. Yes.
So it seems that
Yep.
the quality of taking out these different interventions,
Yep.
their effectiveness is really going to be how good your baseline is, right?
That's right, and I'll sort of make that more specific in just a moment. But yeah.
I guess what I'm curious about is, are there, like, I think it's easier to understand certain patterns of human behavior than patterns of human behavior. And I'm wondering if there are certain things that you would be more skeptical of. If you saw like sex is really much might be harder to get data on than smoking.
Totally.
Like that.
Yep.
How does that sort of?
Okay. So right. These models are not silver bullets. They're not panaceas that magically let us posit things where we have no theory in a robust fashion. There are domains of understanding of human behavior where the theory is just not there about things work in this area, that it's not reliable. Maybe it's change related to addictive behaviors. Maybe it's aspects of the subtle interactions of physical activity and nutrition and sedentary behavior. There are certain domains where the instruments we've used to collect information are quite limited. And this is one of the reasons why in some of the work with Vish, we're making use of new generations of data collection methodologies based on smartphones and electronic data collection to inform theory in these models. There's other domains where this is much clearer. It's not to say that you can't fruitfully build a model where the theory isn't there. It's just that the model is used in a different way in the research investigation. It's not used to give quantitative to give you quantitative understanding of the impacts of interventions, because the theory is just not good enough to support that. What it can be used to do is to help build hypotheses about what may be going on in the world, to help build theory, as it were, and help understand to what degree that theory, when really added up, is consistent with whatever evidence you do have. And that's a constant. But you need to recognize that these models, when they're built in different domains, they have different spheres of reliable use. And fortunately, the models don't always come with labels, that clearly delineate the model is not to be used for policy, quantitative policy advice. And I think this is one of the vulnerabilities of modeling as a field, that because the models do not come with these caveats, they sometimes are seized for use in ways that extend outside of their legitimate ranges of applications. I think this is an issue that's not unique to modeling, but to any sort of evidence, unfortunately. And we all know that with the best empirical data, sometimes it gets used for political reasons, for very different purposes, for certain agendas. And I would just say that there are certain types of modeling that are a little bit more subjected to this, and I would highlight, for example, deterministic modeling, system dynamics modeling, which some of you may have heard of, as a little bit more prone to this, because this sort of modeling gives it does incorporate stochastics, and it gives distributions of results that are a little bit more indicative of error bars or uncertainty. It doesn't capture all the uncertainties, but it can help you be wary of certain overly narrow interpretation of the results. Whereas deterministic modeling, by giving you one number, it can let you fool yourself into the level of precision associated with the model. So it's an area that you need to be especially cautious about. Yeah.
Can you give an example? I find this very interesting. I don't know if you can give an example of an application or maybe a time that you two work together.
Yeah.
Because I am the entertainment right now, like I can stick different things in there.
Sure.
how the world looks different, but you give an example of like in real life.
Oh, sure.
Sure.
So let's use that to segue. Again, I wanted to sing Bloom in confusion. Are you buzzed and bloomed? Okay, great. So let's go to some slides to try to make sense of this, okay? And one of the slides I'll go to first is directly and related to your question. And it's a slide that I posted on the website here. Remind me your name? Michael. So I had posted a slide on the website that's called "Signs a Complex Systems Approach is Desirable," and I had folded this into one of my body of slides that I'll be coming to, but I thought it's worth featuring right now. When would you use an approach like this? I mean, this, as far as I'm concerned, and I should be very explicit about this, this is one tool in the public health toolbox. This is a tool that's incredibly complementary with existing tools. This is not a tool which makes whole generations of biostatistics obsolete or something like that. It's a tool that works hand in glove with a lot of tools. Where does it come in? Where would you look to this for use? Where do we need these models that help us understand how the behavior of the whole results from behavior of diverse parts? Where is it that we need recourse to them to inform decision making? Where is it we need recourse to them to develop theories of what's going on in the world? Well, it's particularly when aspects of the world exhibit features of what we call complex systems. These are systems where the behavior of the whole is greater than the sum of the parts, where we can't simply use reductionistly derived estimates for the different pieces to sort of immediately understand what the implications are, say, for choosing between different options and interventions. And these are some of the hallmarks of complex systems that highlight for us features where we're dealing with a complex system. Presence of feedbacks. Situation where, for example, poverty breeds poverty, it's sometimes said, right? The fact that I'm poor and disadvantaged means I don't have as ready access to healthcare or to transportation options, which meant me getting a stable job, which leads to me less likely to escape from poverty. So it's kind of keeping me locked into poverty. Or feedbacks where we have balancing effects, homeostatic feedbacks involving our bodies that help maintain our temperature at the micro level, but at the macro level, cases where we have learning from evidence over time, cases where we have policies adjusted as a result of observations, cases where a system pushes back against our policies to sort of avoid being successfully nudged. Just take the example of antibiotic resistance, right? Where you put in place a mechanism in terms of a new generation of antibiotics, and it leads the bugs to push back, as it were, to develop resistance in a way that renders it no longer effective for many patients, a decade later. So where we have feedbacks, cases A impacts B, which ripples around to impact A again. We have different names for these vicious cycles, virtuous cycles, balancing loops, etc. But broadly, feedbacks. Path dependence. We know in the areas of social epidemiology, areas associated with understanding the social determinants of health, that early life insults can have a really big impact on overall life trajectories. Exposures very early on. We knew it first through Barker's work in the UK in Manchester, right, where he examined the impacts of adversity in early life and saw that it led to a very high propensity to develop chronic disease later in life. This sort of path dependence where my exposures now don't just sort of, get forgotten over time, but then instead shape my life in profound ways. That's a situation which exhibits complexity. And to reason about how investments at different points in the life course might yield benefits decades down the road, you really want to grapple with this issue. The impacts of investing in early childhood education or maternal and infant child health or what have you. This path-dependent issue comes to the fore. Interagent effects, cases where, if I intervene on you as a result of some policy, it doesn't stick with just you. It pulls around because you may shape the behavior of others. So maybe it's a healthy eating intervention, and your role's in my intervention group, but others in your family are not enrolled, but they're affected because it affects the food eaten at home, or physical activity and norms. The norms that are through physical activity in a group of peers, for example. Cases where there's patterns at a high level which are not obvious where they're coming from. Maybe it's patterns associated with neighborhoods, and sort of results in terms of crime in neighborhoods from intervention in after-school programs for youth. And you're trying to grapple with where are these patterns coming from at the neighborhood level in a way that may not be obvious. Effective sort of localized perception. So in this case, people make health decisions sometimes based on understanding drawn from their networks. You think about health communication and the fact that where I decide, the path that I decide to follow for my treatment for cancer may be shaped in a very fundamental way by my social network. I don't know everything out there in terms of all the resources. What I know is what I can glean from people, my family, people in my set of trusted colleagues, my set of trusted friends. These are factors that might shape in an important way my behavior. And if we want to if we want to bend the curve in terms of quality of outcomes for cancer, it may be that we have to deal with this fact that people do not have global knowledge of what works out there. They don't know the latest evidence. What they know is what they can pick up from others. Effects of scale, I sort of emphasize that with some aspects of emergence. Network effects. So there's this whole science. Are any of you folks familiar with Tom Valenti's work in social network analysis? Networks have profound effects in our life, whether it's social networks, collegial networks, sexual networks, needle-sharing networks. The networks in which we're embedded, they shape our behavior, they shape the risks to exposed, and they often shape the knowledge that we have to bring to bear. And when you're dealing with networks, often there's an interest in network-informed interventions which seek to build social capital, which seek to link people up that previously were disconnected, have any way of sharing information. And when you're dealing with networks, these system science approaches start to be really important as well. Heterogeneity. If we're dealing with a heterogeneous population, individuals of very different types, we're concerned about transfer effects of favoring one group at the expense of the other. Or we're concerned with one-size-fits-all policies, and we need to tailor our interventions for different groups. These sort of models can be useful. But also, sometimes we find, and this is really the case for STIs. Is anyone here working the STI, the sexually transmitted infections? Okay. Yeah, so one of the things you'll find there, and this dates back to Heathcote New York's work in the 1980s, the fact that a small set of the population can have a greatly disproportionate effect on the health of the overall group. So it's kind of like the tail wags the dog sometimes, where 2% of the population ends up being the determining factor for survival of the pathogen in the population. It ends up being the determining factor for exposure for a much larger group. Those are often individuals who have high network connectivity, individuals who are highly vulnerable in terms of other aspects of their risk behavior, have low levels of care-seeking behavior. And if we don't recognize the heterogeneous character of the population, we may be trying to deal with a fictitious, typical individual and fooling ourselves and wasting lots of resources because it's only that 2% that is really having the biggest effect, and by focusing on them, we may have a disproportionate leverage in terms of changing things. Where we're dealing with dynamics over time, we're interested in how quickly an intervention can take effect, for example. In intervention science, the science of understanding how a theoretical intervention can be put into place, how is it made sustainable, how is it brought to scale, for example. You're often wondering about how soon it has an effect. How soon will it be that we can really move those indicators, that we can bend the curve. We need to have a certain amount of time to gather understanding of the results of an intervention before we declare it a success or a failure. And to really understand that over time in a really effective way, these sort of models we've been talking about can be very useful. Where there's presence of delays associated with training, say for an intervention, rollout, adaptation, where there's adaptation and learning on the part of individuals, people's behavior changes. We know from the smoking area, for example, that the introduction of low-tar cigarettes was anticipated to yield strong results. You're exposing smokers to less carcinogen. It was certainly pandered that way or posited publicly by the tobacco companies at the time to be a good investment in health. And of course, it led to fewer people quitting cigarettes and therefore probably net harm. Finally, where there's nonlinearities, where these different interventions considered in isolation, if we combine them, they may work at cross purposes, they may emphasize each other. If you see features like this, or if you're worried about features like this, these sort of models can be very effective tools for probing these things. Yeah?
I have a question about the assumptions these models make. So, I know it varies by model, but roughly, you think these models make hundreds of assumptions, thousands, tens of thousands? What's the magnitude of assumptions these models make?
Yeah. Well, when we say these models, what we have to recognize is heterogeneity in models. So it turns out that models of this sort, it's kind of like I said earlier, models of these sorts are used for different types of investigation. And you'll find some profoundly simple models that have shaped in a fundamental way people's qualitative understanding of a given phenomenon. Let's take Schelling's model of segregation, which, by the way, is built into the software. You can go open it up and you'll find how, a little model with extraordinarily simple sort of assumptions that shows the emergence of segregation-like patterns. And that shaped people's understanding in a quite profound way in areas of sociology relevant to this. But it makes comparatively few assumptions. It's a very general model, but it's not very specific to context. So it's not depicting the emergence of segregation in Detroit or LA or New York, Boston. It's instead sort of a general theory. It's like a caricature of a model in the way a cartoon is a caricature of a person's face. It captures some essential truths. By contrast, there's other models. Let's say the models used successfully in the MIDAS project, the Model Infectious Disease Agent Study, which is of incredible value to the U.S. in planning its strategies for pandemic flu, for various types of conditions such as SARS, emerging infections. It's been a central model for planning. Models are much more articulated. There's much more in the way of assumptions made, with much more in the way of assumptions grounded by empirical data. And so when I say assumptions, I don't mean assumptions that are disconnected from any observations. No, it's assumptions in the same way that we for some statistical models we're using certain techniques to arrive at estimates of parameter values for the assumptions in a different analytical approach, but a similar grounded way to what you might use for a logistic regression model. So there's assumptions being made that can be quite extensive, but are based on a lot of theory behind them and a lot of observation. So you'll find models differing in those sorts. Assumptions are possible. You have age-specific rates of exhibited care-seeking behavior, or the effectiveness of the certain types of vaccine for different subgroups in the population that may inform a large part of that model. So these models vary a lot in terms of how much they posit about the world, and generally it depends on how specific you want to make them about your context and how general you want them to be. Models that are more general make fewer assumptions but stronger assumptions. Models that are more specific to context often make less strong assumptions, but they're more specific to your particular FE context. Does that help at all?
So I think that, but I guess I'm a bit, one of the things I see with these complex modeling is they're very data heavy, so I think they require a lot of data, and there are a lot of assumptions made in general.
Yep.
So making prediction, as you said, is pretty hard. Like, how could you use these models?
So here's the question: what's the alternative?
Nick, maybe I can give an example here. So
sure.
I am on a website with Institute of Medicine right now. I will send you a link. So the Family Smoking Prevention and Tobacco Control Act of 2009, right, that President Obama signed, gave regulatory authority to the FDA, right, so everyone knows. So what they have done is, so they are taking a number of regulatory steps on tobacco control. So they have actually asked IOM to form a committee to use agent-based modeling to predict what happens as a result of a variety of regulatory steps they are going to take. So Elizabeth is actually one of the
right.
So,
yep. Elizabeth
so I will send it to you. So now this committee actually just released, I think, its report last week, and FDA will actually use it to guide some of their regulatory efforts. So is it increasing taxation,
right,
or is it restricting advertising, or is it doing some restrictions or some other types of policies? So those, because they haven't taken all those steps, this agent-based modeling is particularly useful. It will actually, so they can actually manipulate a